One of the best times possible really to practice yoga is during pregnancy. A labour is almost like I describe it as preparing for a marathon. You know, you need to be prepared physically and mentally because it's a very intense, demanding experience.
An experience that Lucy believes can be enhanced by the simple, structured use of controlled meditation, stretches and breathing, and the primary focus of using the breath being the key to a less stressful labour.
And out.
Lucy explains why.
It stimulates your pituitary gland and it sanctions it to release oxytocin, which is the hormone that keeps your contractions regular. So if that's flowing freely, then your labour will be more effective. All the muscles you're not using to keep them soft.
Anyone coming to Lucy's class expecting a totally relaxing time may be in for a surprise.
I also work on getting them to deal with muscle tension in the body, so I do include quite demanding meditations using their arms, which is almost like I'm creating a mini labour really, where they have to stay in the present, they have to breathe, and they have to kind of watch what's going on in the body but stay very still to it and watch what's going on without becoming tense. As soon as you're tense, your breathing stops, your breathing changes, your body stops releasing hormones, and it doesn't feel safe.
Combining her love of yoga with the vocation of helping women through the process of childbirth has helped Lucy's clients in overcoming their fears and transforming the pain of labour.
For the first time in your life, this pain is positive pain. It's your body working for you, and it's not something we're used to. We're used to constricting with pain, closing down. A lot of my clients end up not using gas and air, just purely because it distracts them from what they're doing. So you begin by 2 long, deep cleansing breaths, in and out through the nose, breathing into it and breathing it out.
It seems that using Lucy's brand of controlled yoga works effectively in minimising the distress often associated with labour.
A lot of my clients do the tour around the labour ward and do hear the screaming. And I say, you know, my view on that is that with those women, I think perhaps what happens is, from the very start, when labour is not so demanding or so challenging, they try and find a way in their mind to escape the pain, the discomfort. And then there's a point where they can't run away because it's so intense, and then they've lost control. They've lost being in the present.
Pushing and breathe, breathe, come on. You're in a very precarious situation here, and you're going to fall. You are.
Do you think screaming is a bad thing then?
Some screaming, high-pitched screaming is, because that implies you're kind of screaming from high up, you're losing control. I always say grunting and groaning, quite primitive noises, are always quite positive because you're actually bearing, or you're bearing down, pushing or groaning from the right area. And that's where mantra and sound is great, because women are going to often use their voice throughout their labour, especially towards the end, and they get used to using that. Expressing it vocally is wonderful, but screaming, high-pitched screaming, is out of control screaming.
Many postures and exercises in Lucy's class are designed to help both mother and baby during pregnancy, from optimal fetal positioning and facilitating the birth of the infant.
Squatting is a fantastic thing to practice throughout your pregnancy as well, and to use in between contractions just to kind of intensify the next one, or really get the baby's head coming down. It is very intense, so that's when you really have to breathe and keep all the hands relaxed, jaw relaxed, and keep breathing, knowing that with each very strong contraction you're coming closer to holding your baby.
Following these exercises can dramatically improve your birthing experience.
There obviously needs to be more active birth classes and on the NHS, because it was only through that teaching that I knew you don't just lay on your back and you don't stay in one position, because the baby could get stuck.
A few more long deep breaths.
And for Lucy, the positive feedback that she gets from many of her clients is all the encouragement she needs.
That's one of the best bits, is watching the elation in people when they've come back and their bodies have worked for them and they've felt in control.